The SDGs include a number of global targets and indicators relating to WASH. Of course, there's SDG 6 with targets for drinking water, sanitation, and hygiene, which we will cover in more detail today. But WASH also features in Goal 1 on poverty, where Target 1.4 calls for everyone to have access to basic services, which include WASH. Then there are schools in Goal 4 on education, where Target 4.A calls for all schools to have basic WASH. And under Goal 3 on health, while conditions in healthcare facilities aren't mentioned explicitly, it's clear that you can't deliver universal health coverage without good water, sanitation, and hygiene in healthcare facilities. But there's one thing about the SDGs that a lot of people don't realize, and that is while the targets may speak of universal access or access for all, that doesn't mean that every country is expected to achieve 100% coverage for all of these indicators by 2030. Instead, the targets are defined as being aspirational and global, but each country is expected to set their own national targets, taking into account the global level of ambition expressed in the targets, but also national priorities and capacities. It's actually damaging to consider that a country would have failed the SDGs if it doesn't reach universal coverage by 2030, and this would unfairly penalize countries with low baselines. And we do see countries setting national SDG targets and adapting and adopting the global targets to meet their own circumstances. What's important is not that these targets be the same as the global aspirational targets, but that they set ambitious but achievable short-term and medium-term targets for higher levels of service with a long-term goal of universal coverage. However, a dramatic increase in performance might be required to achieve these targets. The SDG targets and indicators were agreed by the UN member states through a political process, and the UN has designated what are called custodian agencies to keep track of each of the indicators. In many cases, these custodian agencies are UN agencies or teams of agencies, and for SDG Target 6.1 and 6.2, it's WHO and UNICEF through the JMP who are the custodians. Custodian agencies are mandated to maintain global databases and to lead methodological work and develop standards so that the data are consistent and comparable between countries and over time. We are also expected to contribute to statistical capacity building and to establish links with national authorities, especially the national statistical offices, and to develop consistent methods for compiling, aggregating, and verifying national data. The end goal is to have an internally consistent, internationally comparable data set, which can be provided to the UN Statistics Division, along with a brief narrative, to be included in the global SDG database and annual SDG progress report. Many custodian agencies also publish more detailed reports and have their own data portals, like the JMP does. In 2017, the JMP published the first SDG report on WASH in households, which defined the new indicators and established global baselines. Then in 2019, we published an update with a special focus on inequalities that we'll describe today. In the 2019 report, we used nearly 4,000 datasets, and just about half of these were household surveys or censuses, which collect information directly from households. The other half were administrative records, which might come from a ministry or a regulator or a few other sources, like academic articles or data compiled by other international groups. You can also see from this graph that there's quite a lot of data on water and sanitation, but relatively little on hygiene. Nearly all of that is coming from household surveys. Okay, so SDG Target 6.1 is about drinking water, and the target calls for universal and equitable access to safe and affordable drinking water for all. But as we've just seen, that doesn't mean that everyone in every country has to achieve that by 2030. The indicator for this target is the population using safely managed drinking water services, which are defined as the population using an improved drinking water source, that's the MDG indicator, but with some new conditions. That the source should be accessible, it should be located on premises, it should have water that's available when needed, and it should be free from fecal and priority chemical contamination. Now, fecal contamination is a concern for every country everywhere, and E. coli is the preferred indicator of fecal contamination, though thermotolerant coliforms are also acceptable. And there are hundreds of chemicals of potential concern, and different countries will have different priorities for chemicals. But at the global level, we take arsenic and fluoride as the priorities, and that's because these two chemicals can occur naturally in drinking water, they have very serious health impacts, and they impact large populations, hundreds of millions of people. The JMP has been using ladders for a long time to show different levels of service. As in the MDGs, we'll continue to report on the number of people with no service at all who drink surface water directly, and also those that drink water from unprotected dug wells or unprotected springs, which we call unimproved water sources. And in the MDGs, we also reported on the population drinking water from improved sources, like piped water or protected wells. We still do that, but in the SDGs, we've added these new service elements of accessibility, availability, and quality. So if someone drinks water from an improved source, but it's far away, or there's a big queue and it takes more than 30 minutes to go there to get water and return home, we call that a limited service. And if it takes less than 30 minutes, that's a basic service. And if the supply meets those three new conditions, if it's located on premises, water is available when needed, and it's free from contamination, then the household is counted as having a safely managed drinking water service. You can see in the diagram on the right that you need to meet all three of these conditions to count as safely managed. The biggest part of our job is to find national data sources that can be matched to the global indicators and then extract information from them into the global categories. And we put all of the summarized data in Excel spreadsheets that we call country files. These country files have different sheets in them, and here you see the data summary sheet from the Cambodia country file that lists 22 different data sources from 2000 through 2016. Most of these are surveys, but there's one census. And in some countries, we have administrative data sources. Then there are columns for national, urban, and rural levels showing the different indicators: improved water, piped water, surface water, whether the water source is within 30 minutes or not, and whether it meets those SDG criteria about accessibility, availability, and quality. All of these country files can be downloaded from our website, and we'll be showing examples from these for the rest of this webinar. The data from individual surveys or other data sources are extracted and transferred to the country files. Here's an example of the water data sheet from a recent mixed survey in Nigeria. The top part shows the summaries with columns for urban, rural, and total, and the column on the left records the categories as used in surveys, while the columns on the right show the standard global categories used by the JMP. The cells shaded blue are improved supplies, which add up to 69% of the population in Nigeria. The most common unimproved supplies are unprotected wells, used by 18.5% of the population, and 10% of the population reported using surface water. Also, note that in the MDGs, bottled water was only considered as improved if the household reported using an improved source of water for other domestic purposes, like bathing and cooking. But we found that this was nearly always the case, and since the SDG indicator now has separate measures of accessibility, availability, and quality, we've reclassified bottled water and other kinds of packaged water, like sachet water, as improved. But we would still look for an improved source to be located on premises with water available when needed to count for a safely managed service. You can see here that in Nigeria, about 18% of the population in urban areas is drinking packaged water. Similarly, water that's delivered to the home in a tanker truck or by carts with small drums of water is also counted as improved and potentially safely managed for the SDGs. Once we've extracted all the data we can, we generate estimates for all years using linear regression. We do this separately for improved sources and for the proportion of improved sources that are within 30 minutes, and combine those to make the estimates for basic services. We make these regressions separately for urban and rural areas, and then combine them to produce national estimates. You can see in this example from Ethiopia that in rural areas, use of improved supplies is increasing rapidly, but about half of these require more than 30 minutes and would count as a limited service. We get a lot of questions about linear regression. We use it because it's simple and because it makes the most use of all the data available. You can see that there's scatter around the line. Individual surveys don't always agree, and sometimes for the same year you will have 2 or even 3 data points that have slightly different numbers. There were 3 different surveys in Ethiopia in 2016, for example. We don't try to figure out which one is most accurate. We put them all in the regression. Of course, if there's a data point that's a complete outlier or that the national authorities tell us is unreliable, we can turn it off and not use it for the regression. Now, once we have estimates for basic water for all years, we can compare the current coverage rate against the historical rate of progress between 2000 and 2017. And we use those to make these progress or triangle charts, which show if countries are on track or not to reach nearly universal coverage by 2030. On the horizontal axis, you can see that national water coverage ranges from about 40% to 100%, but that in rural areas or amongst the poorest quintile in rural areas, there are countries that have lower coverage, even below 20%. Then if you look at the vertical axis, the y-axis, you see that most countries have increased coverage by around 1 percentage point per year historically. There are a few that are more in the 2 percentage point range, but that's really about the best that's been seen. There are also a few countries where basic coverage is decreasing and the rate of change is negative. You'll see these in the orange zone. So, of the 132 countries that don't already have 99% coverage or higher in 2017, only 46 countries, that's 1 in 3, are on track to reach universal coverage by 2030, unless progress is accelerated. And it's worse in rural areas and for the poor in rural areas. You can see that Tunisia already has very high coverage with basic water at the national level, and it's a little bit lower in rural areas, but still on track for 2030. But the poorest quintile are stuck at around 70% coverage, and that hasn't been changing. So to really reach everyone, something different has to happen for the rural poor. Okay, that's basic services. But to get to safely managed, we need information about accessibility, availability, and quality. Accessibility is pretty easy. Many household surveys ask about how long it takes people to collect water. We recommend a question like, how long does it take for members of your household to go there, get water, and come back? Also, some kinds of water supply, like household taps, are automatically counted as on premises. Here's an example from a PMA 2020 survey in Uganda, where you can see that most of the urban population and almost half of the rural population has water within 30 minutes. But even in urban areas, water on premises is rare, so this can be a limiting factor for safely managed services. Availability when needed. This is actually a lot harder than it sounds. A lot of surveys collect data on water availability or sufficiency or reliability using lots of different questions. The JMP recommends a question like, in the last month, has there been any time when your household did not have sufficient quantities of drinking water? And this has been adopted in the new mix surveys, but still there are big data gaps for availability. Here's an example of the norms survey in Nigeria, which had a slightly different question about if water had always been sufficient during the last month. That's close enough, so we were able to use it. We also sometimes use data coming from drinking water regulators or ministries. Often these data sources will have information on how many people have continuous water supply, but that's a stricter level than necessary for safely managed services. We know that, especially where households have storage tanks, intermittent water supplies can provide enough water to meet household needs. There might be water quality problems, but that's covered separately. Now, there's not a global standard for how many hours per day or days per week is enough, and of course different countries have different benchmarks and standards based on local conditions. So for monitoring purposes, we simply take most of the time as being sufficient, and that most of the time could be 12 or more hours per day, or 4 or more days in a week. It's not perfect at all, and we prefer to have a question asked directly of households, but if we don't have that, we do use this kind of administrative data. And we see that water from improved sources is not always accessible on premises. In fact, very often it's not, especially in rural areas. Also, improved water is not always available when needed. This is a common issue in urban settings that have a lot of water cuts. Last but not least, we have water quality. We're looking for data on E. coli or thermotolerant coliforms to measure fecal contamination, and also looking for arsenic and fluoride, which are significant problems in some countries. In most cases, we get these data from administrative sources, but these often have data gaps. They may cover only formal systems, or only piped water, or only urban areas. Sometimes they don't include the parameters we're interested in, or include too many parameters all bundled together, and we can't extract the information on E. coli, arsenic, and fluoride. We've also been working with household survey programs to measure water quality during national surveys. This table shows one of the first experiences in the Bangladesh 2013 mix, which measured both E. coli and arsenic. Usually, where data on both E. coli and arsenic or fluoride are available, E. coli is the bigger problem, and that's even true in Bangladesh, which probably has the most widespread arsenic contamination in the world. After being tested in Bangladesh and Ghana, this module has been refined and standardized and has now been completed in over 30 surveys and is continuing in about 15 surveys per year. You can see from this list that it's been applied in a lot of countries, and often this has been the only nationally available data on water quality. The surveys in italics are either not yet completed or not yet published, and the ones in parentheses are subnational. In these surveys, the field teams are provided with a portable kit that allows measurement of E. coli without needing to transport samples back to a laboratory. It also doesn't require electricity, though in countries that have good access to electricity, sometimes electric incubators are used. Here you can see some of the results from the first surveys to be published, and you can see that there are really big disparities between and within countries. The test shows which supplies are free from E. coli, those are the blue bars, which are considered to be low risk, but also shows which ones have medium, high, or very high contamination. We find that usually piped water and bottled water have the best quality, but in all countries there's some contamination in all types of water supplies. So, we take all of those data inputs, we run the linear regressions, and then we produce national estimates for improved water, for basic water services, for accessibility and availability and quality. Sometimes we get data on some of these indicators from different sources, so we can't always say which households have all three of those safely managed elements. What we do instead is at the urban or rural domain level, we take the minimum of the three and use that as the limiting factor for safely managed services. So here you see at a global level, 92% of the population using improved water sources in 2017, nearly all of that being within 30 minutes and counting as a basic service. Accessibility on premises, availability when needed, and quality are all around 70 to 80%, but quality is the lowest of them at 71%, so that ends up determining the global figure of 71% of the population having safely managed drinking water services. That means that there are 19%, that's 90% minus 71%, with basic water services, 3% with limited services, 6% with unimproved water services, and 2% drinking surface water. If we look at the trends, we see that safely managed drinking water has increased by about 10 percentage points since 2000. That's about 0.6 percentage points per year. But in some regions, the progress has been more rapid. Central and Southern Asia, and Latin America and the Caribbean, for example. But there are still 4 SDG regions where we don't have enough data to make estimates of safely managed drinking water. This is because of a lack of data on water quality. Finally, if you look at the map of safely managed drinking water services, even though 117 countries had estimates, there are huge data gaps among low and middle income countries. The water quality module and household surveys can help fill some of these gaps, but what is really needed are stronger government systems for oversight of water supply, like independent regulators. We really want to encourage national systems like these because a household survey can give a snapshot of what the situation is, but national surveillance and regulation programs can do that, but can also, more importantly, help to improve the quality of services. Let's stop now for a break, and I'm happy to take some questions about the background or about drinking water before we move on to discussing sanitation and hygiene.